talk about food allergy. So, the food allergy is increasing in every country in the world. So I don't know the prevalence data in Vietnam, but this is the Japanese data. This is the European. Here, this is the American data of self-reported peanut and tree nut allergy, threefold increase in this 10 years. And this is the Australian data, fourfold increase from 95 to 2005. Also, this is the Japanese data, the school survey in Japan, all schools in Japan. So we conducted this survey in 2007 and 13, and almost twice the prevalence of food allergy. So we don't know why the food allergy is so increasing. Maybe the Dr. Hugo van Beaver's talk, the skin problem or environment may be the cause. Anyway, we have to deal with the food allergy. The most important thing is the right, correct diagnosis. So before going into the diagnosis, I just briefly touch on the classification of food allergy. This is the European classification of food allergy. They classify food allergy as IG-mediated, cell-mediated, and mixed IG and cell-mediated allergy. So this is very useful classification, but this is immunopathology-based classification. So it may be good classification, but not useful for the pure daily practice. So we have the clinical classification in Japan. So we have 5 classifications in Japan. So this is kind of complicated slide. So this I just made it in the cartoon. So in the neonatal period, we often see gastrointestinal allergy. So the infants who drink milk have the diarrhea and vomiting and bloody stool, and they may be the food-induced enterocolitis syndrome, FPs. So this disease are often confused with other severe abdominal diseases. So maybe the baby got the surgery, but all you have to do is suspect the presence of food allergy, milk allergy, and stop milk, and symptoms disappear. And you can challenge it and then confirm your diagnosis. So for maybe 1 year of the elimination of the milk, this condition will resolve usually. Another type of food allergy is infantile atopic dermatitis associated with food allergy. As Professor Hugo van Beaver said that atopic dermatitis in babies and infants a cause of food allergy, maybe the cause of food allergy. So when you see the babies with severe atopic dermatitis, they may have food allergy. But they haven't eaten any egg or milk. But you can detect sensitization, and the first time the baby eat the milk, egg, then they get urticaria, generalized urticaria and anaphylaxis. So this type of is very, so you have to be careful in this early age of skin problem. Then they go, the atopic dermatitis gradually resolve. Then they go on to most prevalent immediate type food allergy. So you eat egg or milk, and then in 30 or 30 minutes you get urticaria, vomiting, and kind of immediate allergic symptoms. This is the type. And there are two other specific type of the food allergy. This is food-dependent exercise-induced anaphylaxis. Food itself does not cause symptoms. Exercise itself does not cause symptoms. If you combine two, then patient get anaphylaxis. So at the school lunch, the boy eat fish. Then after the afternoon class, they have the gymnastics class, and they get he gets general urticaria and collapse. This type of food allergies. Also, another type is oral allergy syndrome, or called oral food allergy symptoms syndrome. So the fruits or vegetable cause immediate type of allergic symptom, but only in your mouth. So irritant sensation in the mouth. So this patient is first sensitized to pollen, then close sensitization to the same vegetable or other fruits, and then cause the symptom. So the first type, infantile atopic dermatitis, as Dr. Van Beaver said, if patients have atopic dermatitis, and that's severe enough, the risk to have the sensitization to egg or cow's milk or peanut is very high. So when you see an infant with severe atopic dermatitis, think of food allergy. And this is a flow chart we use in Japan. So when you see the patients with eczema and treat properly with moisturizer and corticosteroid and see what happens. And if there's no change, you test the IgE for the food, and they go on to the diagnostic procedure. And this is the immediate type flowchart for diagnosis of immediate type food allergy. Okay. And when you try to diagnose food allergy, you have to think of the prevalence of the food allergen in different ages. This is the Japanese prevalence of food allergy. So in young children, number one is hen's egg, and then second milk and wheat. But when you get older, the most prevalent allergens, crustacean, the shrimp or crab, and wheat, fruit, fish. So totally different. So what do you think? So if your patient is older, this fish and shrimp allergy, you have to think about this. And young age, egg or milk. And this is the diagnostic test for IgE-mediated food allergy. The principle is that you detect the allergen-specific IgE or allergens IgE-mediated cellular responses. Cellular responses, as Dr. Wang said, that skin prick test is the gold standard, easiest way to diagnose, to detect IgE sensitization. And then you can measure serum-specific IgE or other basophil activation tests. But gold standard of the gold standard of the diagnosis of food allergy is food elimination and challenge. So IgE just tells you this patient is sensitive to certain allergy, but does not always mean this the patient symptom can be caused by that particular allergy.